Good morning, everybody. Can you hear me? Yes. Excellent. Thank you very, very much indeed for your very kind invitation to speak at this very important scientific meeting of the Indonesian Clinical Epidemiology and Evidence-Based Medicine Network. It's such a pleasure to be here in Yogyakarta with you and to share some of our experiences, both internationally and those based in Australia, in using evidence to inform health policy decisions. This is a photograph of the building in Melbourne at the Alfred Hospital, where the Australasian Cochrane Centre is based and where Steve and my offices are. Does it reach? Oh, hang on. The back. So here, you can see in this corner here is my office. Steve's is slightly out of view. It's particularly wonderful to be here at this time in Indonesia's history as you move towards universal healthcare. And I understand that we have heard a lot more about that from our previous speaker. In this context, it's particularly timely to consider the role that evidence, and in particular Cochrane evidence, can play in supporting this extraordinary commitment. As said by The Lancet, a very important international journal, in this editorial in January, Indonesia should be commended wholeheartedly for its move to universal health coverage. What I'm going to speak about this morning in the time I have are these four things. Firstly, the importance of evidence in public policy. Then I'm going to present some of our understanding at the Australasian Cochrane Centre of what evidence-informed health policy is and and our approach to it. I'm going to give you some of the Australasian Cochrane Centre's experiences and tell you a little bit about some of our projects within the area of evidence-informed health policy. And then finally, I'm going to show you some examples from Cochrane colleagues overseas in countries other than Australia and Indonesia. So, to start, why is it important to use evidence from research in informing and developing public policy? I would agree with our esteemed previous speaker that it is not possible to have good healthcare without research. In 2006, the World Health Association, through its then Director General Lee, stated that there is a gap between today's scientific advances and their application, between what we know and what is actually being done. Health work, and all of you will know this, teaches us with great rigour that action without knowledge is wasted effort, just as knowledge without action is wasted resource. This articulates for me the two key concepts of why we need to make the best use of research in making health policy, both to guide better healthcare and to make the best use of our investment in research. The WHO, in its 2005 report, have described making better use of research as one of the most important challenges for public health in this century. The Cochrane collaboration agrees with this, and we have articulated it in our mission statement. This is the mission of Cochrane internationally, or the vision, and our vision is a world of improved healthcare where decisions about health and about healthcare are informed by high quality, relevant and up-to-date synthesised research evidence. When we think about health decisions, this means we need to work to make our Cochrane reviews useful and used by those responsible for making healthcare decisions. That is, they need to be both useful and used by policymakers, whether in government or health services, by clinicians, by patients, and their carers. Steve's going to talk a little bit more about the Cochrane strategy to 2020, but this is our roadmap for moving forward over the coming years. Most relevant to this talk, however, is the third goal within this strategy. And here we have a specific goal to advocate for the use of evidence to inform health decision making, in health policy and in public health, in clinical practice and in the decisions of individual patients and their carers. In short, we have a goal to become the home of evidence. There is a large amount of work, as many of you will know, in developing clinical practice guidelines and other tools for clinicians and for the public. And Steve will talk a little bit more about some of these. But for this reason, in this talk, we will focus on the decisions of health policy makers. The importance of using evidence in public policy has become increasingly evident in Australia and around the world. Ways of strengthening evidence-based policy has received a lot of attention, and there is considerable effort to grow capacity in both researchers and in policymakers, and I'll tell you about some of those efforts shortly. This report from 2009 is from the Australian Government's Productivity Commission, and in this report they have identified that evidence is crucial to good public policy in two respects, for two reasons. First of all, it helps policymakers work out which policy options are likely to achieve the best results. But also, it helps in getting a public policy implemented in circumstances where there is opposition to it. So, given the recognition of the importance of underpinning health policy with evidence from research, and given Cochrane's commitment to this as part of our roadmap for the next 5 years, how can we best go about strengthening the capacity of both researchers and policymakers towards achieving this vision? Now, I'm afraid this may be a little hard for you to see, but this model has been put together by our team in partnership with another Australian organisation called the Sachs Institute, who also work in evidence-informed policy. This model or framework that has underpinned the approaches that we have taken in our projects related to evidence-informed policy is designed to recognise that health policy making is complex and it is rightly influenced by more factors than research. So research is critically important, but it must sit within the broader context of the many other factors that policymakers need to consider when making a health policy. It will be hard for you to read, but what we are trying to articulate here in the blue half circle at the top are the factors that influence policy. So in the square box is research, and I'll show you that in a moment. But also we have other factors such as expert advice, legislative policy infrastructure, public opinion, the media, stakeholder interests, the economic climate and available resources, political ideology, and importantly, cultural context. This bottom part of the model, which pulls out the research component, so what we have here is the way that research will influence policy, but it sits within that broader framework of all of the other factors. Here we have articulated what needs to be in place to ensure that research can be incorporated to inform public health policy. So first, there needs to be an underpinning available amount of research, and that's the blue line across the bottom. There needs to be a reservoir of available research, and this is the first important context in researchers and policymakers working together to ensure that the research that we invest in is policy relevant. There then needs to be capacity for policymakers to be able to use the research, and a cultural will within a policy agency and recognition that research is valuable. Policymakers at an individual level, when making a policy document, need to be able to undertake a number of what we call research engagement actions. And for those of you who've been in the workshops with us over the past couple of days, you will understand that these actions are around being able to find the available evidence, being able to recognise its quality, being able to apply it, and then being able to incorporate it within the other contextual issues to make a determination of its use in public policy. So much of the policy work that the Australasian Centre has done has been underpinned by this overarching view of understanding that other factors will rightly influence policy, but even when research is to be incorporated, or in the times that research is incorporated, which is the majority of the time, then we need to make sure that there is available, well summarised syntheses of research evidence which is easy for policymakers to find, able to be understood, and appropriate to be used in order for policy to be in line with the best evidence from research. So this has meant that within our work plan around evidence-informed policy, we have two key aims. The first aim is to ensure access to evidence from Cochrane Systematic reviews. That is, to make sure that our evidence is available in a form that is appropriate and relevant for policy. The second key aim is to grow capacity for researchers and policymakers to work together. I'm going to talk about each of these examples over the coming moments, but just to orient them to you, within our aim of trying to ensure access for Cochrane Systematic reviews, we have a program of work around preparing and disseminating tailored summaries of Cochrane reviews that are relevant to the Australian policy environment for policymakers. We have a project with our National Health and Medical Research Council for deriving position statements from Cochrane reviews, and we are working on a project with our College of General Practitioners, our main primary care organisation, around summarising evidence in the form of a handbook of non-drug interventions. But equally, we are doing work in trying to grow capacity for our policy-making colleagues. We're providing support to the National Health and Medical Research Translation Faculty, and again, I will show you that in a moment. We're conducting training and support for policymakers in the use of research. We undertake consulting and commissioned reviews and stakeholder dialogues. So let's talk through those one at a time. This, the first of our projects, we have been doing for a large number of years, since 2003, revamped at the beginning of this decade. And here, this flagship project, we are trying to increase the access of Cochrane reviews for policy in Australia. It's called CRISP, or Cochrane Reviews of Interventions Summarised for Policy. And we have a large number of summaries on this website, about 200, with an interface and a very structured summary format. If we have a look at these, you can see that this is what the site looks like. There is a search capacity up the top, or the ability to browse by topics. And these topics are arranged in the important or high priority topics for the Australian policy environment. So here is an example. This is a summary of interventions for improving coverage of child immunisation, and this one is for low and middle income countries. And you can see that we have pulled out the key messages of this policy summary. We've included the PICO elements So the PICO elements from the reviews are displayed in the section called the Review at a Glance. And we've included the plain language summary from the Cochrane reviews, which gives the key findings of the reviews in accessible language. Also, we've included some information about the individual results from the individual studies. The second of our projects is working with the National Health and Medical Research Council on the development of what we call position statements. This is a pilot project, and we're doing it in partnership, as I say, with the NH and MRC. It's at a very early stage, and the prototype continues to be under discussion, but it's aimed at policymakers, health professionals and consumers. And here we are pulling out summaries designed in the format you can see here of topics of importance for informing decisions about individual care. They're based on the priority areas within Australia, or what we call our major health issues. And the orange banner across the top there is a code, if you like, or a way of indicating that more research is needed. So that banner could equally be red or green for giving a summary view of the evidence. This slide is from the HANDY website. The HANDY stands for Handbook of Non-Drug Interventions, and this is our summaries project in partnership with the Royal Australian College of General Practitioners. And here we are pulling together the evidence from Cochrane reviews and other sources and performing a summary that is targeted at GPs, at clinicians, which recognises that the most important part of the summary for them is a description of how to undertake the intervention. So here you can see an example of the summary of COPD, or chronic obstructive pulmonary disease, of the evidence-based intervention of pulmonary rehabilitation, and there is brief information from the Cochrane review on what the intervention is, the indication and the precautions, and then a detailed description of how to implement that intervention. So that's a taste of our work in developing summaries. Moving now to some of the projects that we are undertaking in growing capacity for the use of research. The Australasian Cochrane Centre has been supporting the Research Translation Faculty, which is a new innovation from the National Health and Medical Research Council. This faculty, which includes about 2,000 researchers who are funded by the National Health and Medical Research Council, was established as a key advisory forum to help our National Health and Medical Research Council confront key challenges for the translation of health and medical research in Australia. And to date, we have two main areas of work within this faculty. The first is developing up what are called cases for action, which is identifying areas of practice and policy in Australia where there needs to be advice about increasing the amount of research translation. The second part of work is in an annual symposium where researchers come together at the Research Translation Faculty Symposium to discuss research translation strategies and to move the science of research translation forward. This, our third faculty symposium, was held last week in Melbourne, and if any of you are interested, many of the presentations from that symposium are now available on the NH and MRC website. Also focusing on growing capacity, we are increasingly undertaking training and support for policymakers in the use of reviews. The Australasian Cochrane Centre has long been established in training people how to do systematic reviews. Over the past couple of years, and moving forward into the future, we have an increasing emphasis on training people how to use and apply systematic reviews. And this is an example of a program we've undertaken with a policy agency in partnership with Cochrane New Zealand earlier this year. Also, in the area of growing capacity and ensuring that we have a reservoir of available evidence to inform policy, increasingly we at the Centre are undertaking commissioned reviews where we will do a specific targeted Cochrane review at the request of our government or other NGO agencies. These reviews may be used to inform policy and clinical practice guidelines in the absence of an existing systematic review. Sitting along with this commissioned work, we are providing support and membership of advisory committees to enable the application and use of these reviews into policy. And we've also begun to undertake some training sessions on how to commission systematic reviews. Finally, under the platform of work around growing capacity, we are partnering with other Cochrane entities in what is called a stakeholder dialogue. This slide is from the NTRI, which is the National Trauma Research Institute based at the Alfred Hospital with us in Australia, and they host a Cochrane satellite group for the effective practice and organisation of care. Within that forum, or stakeholder dialogue, our colleagues have undertaken a number of steps based on the McMaster forums that have been well published by John Lavis. Here, they will work with stakeholders, policymakers, clinicians, patient advocates, members of the public, in defining major challenges within a topic, in bringing together the relevant research information in the form of systematic reviews, then in convening a stakeholder dialogue to bring people together to discuss the evidence and what it means in their context, and then supporting the implementation of the recommendations that come out from that dialogue. So recognising the process needed to be undertaken to go from research evidence through to implementation in consultation with the people making the policy. So that is an example of some of the initiatives that we are undertaking at the Australasian Cochrane Centre in the area of evidence-informed policy. What of some examples from international colleagues? This kind of work is taking off all around the world, and there are others who have really trailblazed in this area, and I'll show you some of their work now. This is a summary from the Cochrane Infectious Diseases Group called Evidence Update Summaries. And here you can see a summary of the Cochrane Systematic Review on deworming programs in resource-poor settings. These evidence updates are available on the Cochrane.org website as well as the Infectious Diseases Group website, and they have been developed over a number of years to be published in a format that meets the needs of policy agencies who are making decisions around the management of infectious disease. But by far the group doing the most amount of work in this area is McMaster University in Canada, led by John Lavis. And this resource or database called Health Systems Evidence is an extraordinary resource for people wanting to undertake evidence-informed policy. It is a database that includes the most comprehensive free access point of evidence to systematic reviews that may be of interest in policy. The relevant Cochrane reviews are included in this database, but it also includes systematic reviews that move beyond Cochrane. This slide is just to give you a flavour of what this website looks like. So here we've done an example search of looking for systematic reviews that are around the skill mix of health professionals and workforce issues. And you can see that it's brought up a large number of Cochrane reviews, other forms of systematic reviews, and it provides you an entry point to being able to find those reviews. Extremely important for people making health policy decisions in low and middle income countries are the resources from the support collaboration led out of Norway. This is an example of a support summary, and there's been a massive amount of work done by this team on the best ways to summarise evidence for people in this setting. Here you can see a summary of a Cochrane review of do lay or community health workers in primary health care improve maternal and child health and tuberculosis outcomes. Importantly, support reviews include this table that lists out the key points of applicability of the relevance of the review for low and middle income countries. It describes the populations in which the evidence was undertaken and the kinds of resources and impact of implementation. So to finish with a loop back to the importance of evidence informing policy decisions, a quote from John Lavis, who has led this field for many years. In his report in the Millbank Quarterly, John said, "A decision-relevant culture can be created among researchers." In other words, we can work with researchers to be doing policy-relevant research. And a research-attuned culture can be created among decision makers, where they will look to the evidence to inform their health policy decisions. Thank you very much.